Hi, we are the Twitter presentation group representing a person with no insurance. Click. All right, so why does someone have no insurance? It can be for a multitude of reasons. It can be because they're not employed, they're self-employed and choose not to do it. They're employed but simply can't afford it. They lose eligibility for a Medicaid or Medicare. They think they don't need it, so they just don't want it and they just don't get it, or they don't know how to get it, and it can be many reasons beyond this. So what are healthcare resources for a person without insurance? Well, there's obviously pro bono clinics. We know that because we work in one. Any person can go to any emergency department and they will be treated regardless of their insurance status. You can be billed for this, but it has been, there has been cases where they get charity work or charity cases where they don't have to pay and they don't receive any bills. And of course, there's just out of pocket expenses where you use cash or credit in clinics, such as a dentist, PD services, etc. So what is the cost of healthcare resources for those without insurance? Potentially zero, again, as I said, with pro bono or charity services. These people do not have to pay anything. Or they're going to have to pay at cost because they have no insurance for this, of course. And because of this, most healthcare in our country is privatized. So the price of any medical coverage you're receiving is going to vary a lot. So standard for PT, I know, is typically between $60 and $100 in the state of North Carolina per session, which seems really high. But I guess it depends on how many sessions you're having compared to the price of your insurance. Click.
Okay, so depending on where you live, there can be a time delay in the healthcare resources that you may receive at any given point in time. In the US, you can see many providers the same day, even without insurance coverage. This can differ to each country, where you may have to wait longer for elective procedures, such as things like joint replacements, etc. In terms of emergency procedures, the United States and other countries are comparable for life-saving procedures. Several online resources state that it takes on average 24 days to see a doctor for the first time in the USA. The average wait time for services in the National Health Service, which is in the UK, varies depending on location and procedure, with a maximum waiting time could be anywhere up to about 18 weeks or so. So in terms of cost of healthcare, when comparing the United States model to the UK model, our group has a patient that basically our patient falls within the gap in terms of healthcare coverage. And in our hypothetical scenario, the cheapest option for our healthcare is a catastrophic insurance plan through Blue Cross Blue Shield, which is affiliated with Wake Forest Baptist Health. This plan in particular costs about $87.35 a month and has a deductible of $8,150 in network. And at a minimum, even if our patient does see a doctor at all during the year, he will still pay about $1,048.20. This plan, however, does not cover anything in network until the deductible is met, and prescriptions don't count towards deductible either. Compared to the UK, the patient wouldn't spend any other money towards healthcare under the NHS. However, their taxes would be higher due to the cost. It is estimated that each taxpayer in the UK pays about £2,892, which is about roughly $3,729 in US terms, in taxes to assist in covering the NHS costs. And this number varies based on the patient's income as well. The amount he would pay per year is significantly higher in the UK compared to the US if our patient doesn't have any medical visits for the year. However, if this patient were to seek a doctor, or if the patient needs PT or a prescription, or if the patient fell and broke their arm, then it could potentially be significantly cheaper in the UK to have their plan.
So some of the benefits of Medicare and healthcare for all is that everyone is able to get access to healthcare. People who fall in the gap, like our population that we're representing, is less than designed to weigh the cost of healthcare against other needs they may have. Also, if they need emergent care, going to the emergency departments and have something come up, then those departments are required to see patients with medical conditions, regardless of their ability to pay for care. So it kind of evens out the playing field and allows people to get what they need when they need it. Some of the concerns with Medicare or healthcare for all, people have some concerns about the higher taxes, the long waits, the decreased pay for medical workers, which would be doctors, nurses, other healthcare practitioners like ourselves. And these are all weighed against pro and con. Is it worth it? So whenever the conversation comes about for if we should have healthcare for all or Medicare for all, these are three of the big tactics or the big argumentative points that people have different scene of opinions about. So then our group decided to kind of go into different presidential candidates' proposals just to see how they are receiving or thinking about the idea of healthcare, Medicare for all. And this is all coming directly from their campaign sites on their for their future upcoming elections. So Donald Trump has, just as an example, as a landmark of Tax Cuts and Jobs Acts, President Trump repealed the individual mandate, which forced people to buy expensive insurance and tax those who couldn't afford it. The Department of Agriculture provided more than $1 billion in FY 2017 to be used to improve access to healthcare services for 2.5 million people in rural communities, and so forth and so forth. This is just to show kind of where they stand on this issue.
So the next presidential candidate is Joe Biden, and he is, these are also from his campaign website. So this is kind of what his key points are. And basically he wants to kind of work off of the Affordable Care Act that was enacted under President Obama. And he wants to make healthcare more affordable and have more access for more people. Next. The last candidate is Bernie Sanders, and he wants Medicare for all. He wants to make it so everyone is covered and gets health care. He wants to expand it into dental, hearing, vision, home, and a lot more. And he wants to decrease the prices of the pharmaceutical companies. Basically, his main slogan is that healthcare is a basic human right.
Okay, we wanted to take y'all through some of our just Twitter timeline that we did over the course of the semester. So we started out by just looking at what the uninsured rate was by state in the United States. So we just gave a little background on that. And then we looked into just a couple of resources on what the average cost of certain medical necessities may be, one of those being blood testing, as you can see in our second tweet. And then we also did gave a little bit more background on like urine analysis and things like kidney functions that are typically checked on a regular basis and what that may cost for someone who, say, doesn't have insurance but needs a test such as that. And then we went into just if somebody who didn't have insurance wanted insurance, how much it would cost them to pay like out of pocket for a deductible, depending on their work status or their home life, or just how much it would cost to have just one person on it based on like a family. And then we learned that there are a lot of people in the healthcare system where there are discrepancies among the different levels of staff as well. And then we thought this little graphic was cool. This is for North Carolina. It's put out by the OECD on the regional well-being of North Carolina. And they actually have these for every state. And it kind of just gives you an idea of different categories and how well we're doing in each category. Each category is out of 10. So civic engagement is the highest on here, and then safety is the lowest for North Carolina.
So our next tweet was talking about how the rate of uninsured have actually decreased, but people of color are still more likely to experience being uninsured, but we're hoping to see this continue to decrease over time.
So our next couple tweets were about when we watched the film Bending the Arc. And so we talked about that and how it was important to look at world health issues. And then our other tweet was about how universal health care should be a fundamental right, but that there are many, many obstacles, and it is a very highly debated topic still currently.
So different countries have their own models of healthcare that have pros and cons. Like the American healthcare is in some kind of quasi between capitalism and a socialist system. Then if you look over at some of the European systems, some of them are total access. Some of them there are premiums. You still pay if you want to get special care or jump the lines for care. And then there's just so many different ways that other countries have like hybridized different ideas to and tailor fit it care system. But there are problems with every system. And the main limitation for Americans without healthcare is that the prices for it can be really high, or even if you have insurance, the deductibles make it high that you almost might as well not have insurance.
So the next thing we talked about was whether or not healthcare should drive political affiliations or decisions, or whether we think it's possible for them to be independent of each other. And so we discussed this a little bit in class, and we kind of put that out on our Twitter to see if anyone had any opinions about that. And then we also talked about how in the political climate, healthcare is a huge topic, especially in these upcoming elections. And so we said it was important to check in with not only with the national government in the elections, but also with local governments to see what the local governments are doing about healthcare and how the healthcare access is in their local areas.
We also looked at just how many people were uninsured as of 2017, and we realized that that rate has risen since then. But every case is different, but it is definitely a cause for concern and something we should be considering during this time.
So make sure that you're checking in with your provider or pharmacist to make sure that the medications you're taking are things that you need to be on, because with the increase in medications, there's an increased risk for interactions between those drugs. So being able to check that. There are several websites out there that'll let you search your specific medication and dosage to see if there is an interaction. Because like in most jobs, you start to get into habits of the things that you prescribe, and sometimes some of those interactions can be overlooked.
And so here we also, it's kind of going off of what Zach was just talking about. Many of the patients that we see in the clinic are in the category of polypharmacy and are having several, sometimes even double-digit numbers of medications that they're on. And so we put that out on our Twitter to get some discourse about that.
And on March 16th, we started a direction to some of the more current situations, such as COVID-19. We wanted to tweet out to let those who didn't have insurance know that they could be on the lookout for free screening opportunities and take the preventative measures if they are able to. I know some people are working and are unable to self-quarantine, but if you can, you should. Also, there are free screenings that could be in person, driven to you by phone or online. So it's all great resources for people who are trying to go through this pandemic without insurance. And we also listed some of those sources below so that they can find whichever ones were available in their area if needed.
On April 6th, we actually found a little bit more information about COVID-19 and how it was affecting those who didn't have insurance. We looked up a couple of the costs and saw that it costs about $30 to $60 just for an inhaler and about $5 to $50 for the medicine itself. This article goes into a little bit more detail on how much these could add up over time if someone who didn't have insurance got the coronavirus and how devastating that could be to that person. Just a little bit more on COVID-19 without insurance. The disease itself is age dependent, or the virus itself is age dependent. So they will still receive care and they will get tested for it, but these costs could accumulate over time, causing them to get into a bit of a financial crisis if and when they recover from the virus itself. And there's also the possibility that a lot of people are losing their jobs during this time. So that can cause a lot more people to be going on without insurance and not be able to pay the medical bills that come after all this virus is over. And then a lot of things we don't think about could be the flu, because it also has a great impact on society. And if you don't have insurance just during a typical flu season, you can acquire some bills as well.
So while going through the various obstacles and challenges that come with being an uninsured person in America, we've seen the large impact that inequity can have on an individual. So as far as our group's position, we believe that although there are many ways to solve a problem, a system with universal healthcare would most likely give immediate benefits and relief to those in our situation, or those who fall in the gap, those who don't have the current financial means to buy it or what have you. A universal healthcare system would most likely give them the immediate relief needed. Although we are saying this, our group did want to reiterate that no system is perfect. We talked about the pros and cons of universal healthcare system, and we know that any system that would need to be implemented or changed would have its own obstacles to come over. But as being uninsured persons, we believe that this stance of universal healthcare would best benefit our group. In short, it all depends who you are, the time, the resources, the money, and all of those things to consider when making a system work or changing a system. We want to mimic the type in the UK or Taiwan, but regardless of that fact, we just think that by implementing a universal healthcare system, those who will need healthcare can get it without it having to be an afterthought. And that is our presentation. If you have any questions, please feel free to let us know. And we have our references listed below.